Welcome everyone to today's webinar. I am Mackenzie Bean with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We are looking forward to hearing your questions. Additionally, in about a week following the webinar, we will be sending you a copy of the presentation to the email you used to register. At this time, it is now my pleasure to start today's webinar by introducing John Dwight, Vice President of Marketing and Partnerships at Simply, who will kick off today's presentation. John, I'll turn the floor over to you.
Thank you, Mackenzie, and thank you for everybody joining the webinar this morning. I'm only going to speak for a couple minutes, and to open us up, I am really excited that we have Tim Reiner with us here today from Adventist Health System. Tim is the Senior Vice President of Revenue Management at Adventist Health. He previously served as the Assistant Director of Patient Financial Services at Florida Hospital Memorial System and Central Billing Office Director at Florida Hospital Centric Care Network before joining Adventist. In his current role, Tim leads initiatives for Adventist Health System utilizing EDI transactions, merchant services innovations, self-service tool, business intelligence advances, and next-generation revenue cycle health information systems. Tim has a BS degree in business administration and a Bachelor of Arts in English from Southern Adventist University and an MBA from Webster University. And Tim is here to join us to share the transformation that he is leading at Adventist Health System in terms of really taking their patient-facing revenue cycle from an area that was one that was challenging for patients to navigate into something that's really turned into a source of patient delight and a real driver of satisfaction and revenue cycle success. And before I turn over to Tim, I wanted to just set the context for what is the motivation for investing in patient financial care. And I think this cartoon is kind of an interesting way, thinking about what this feels like from a patient perspective. Stressful, seeing healthcare bills, and so that that leads people to sometimes ignore them. But what's been going on, and in the industry, as we've been feeling, really the patient has become the new payer. So in a pretty short period of time, patients have moved from being a very small portion of the overall picture of revenue to being up to 35% of revenue today. So it really is significantly now a consumer interaction when it comes to the billing experience. But the experience hasn't really kept up with that. When you ask patients, 3 out of 4 of them say they don't actually understand the bills they're getting. So an important payer, but one that's not really being spoken to as a consumer. And then you layer on top of that the affordability challenge. And so it's one thing to look at these stats, and I'll read them off, and then it's another thing to kind of put them in perspective and context. But 1 in 2 patients face over $1,000 healthcare payment responsibility. And you pair that with 2 in 3 households have less than $1,000 in savings. And there's some obvious tough math there, but the way I think about this is some of the largest bills that I have are things like car payments, mortgage or rent payment, student loan. And those are big payments, but I also understand them and they're expected, and they're still difficult to make. So now we couple the fact that you have patients who don't really understand these bills and they're large, and it's not surprising that you get to that state on the last data point here, that 1/3 of patients are pursuing less or no care because of the lack of affordability and lack of understanding of what the bills are. So it's not just a financial problem, it's actually a really acute care problem as well. But to leave us on a good note as we kind of move into Tim talking through what he's done at Adventist, there's light at the end of the tunnel. We know that when you do this well and when the patient wins, the health system wins. So we know that patients, when they're satisfied, they're twice as likely to pay their bill in full. They're 5 times as likely to recommend the provider. So there's a lot of upside to doing this right. There's a lot of tools and a lot of ways and techniques to do it right. And what I'll now do is kick this over to Tim to talk through the challenges they faced at Adventist how they prepared a vision for how to address those challenges, and how they're now executing on it and are looking towards to things that they'll implement in the future to keep making things even better for their patients. So Tim, with that, I'll turn it over to you.
Okay, perfect. Thank you, John, and appreciate everybody joining us today. Again, just to sort of lay the land here of our organization so you get a sense of, some of the unique situations we have in different markets. So we're not a regional system or a local system necessarily. We've got patients in multiple different states that may have different expectations around our billing process. And so we just a graph here to show that we've got hospitals primarily in Florida, but also in several other states in the Southeast, as well as the Midwest and Texas. We don't really go further into the West. And pretty large organizations in particularly Florida and some of our other markets in Chicago. So, seeing a lot of patients, up over 5 million patients served each year, and across the whole organization, approximately 80,000 employees and physicians as well. So, John, you can move to the next one. What we really are coalescing around right now as an organization is this sort of focus on the consumer. And I think often in healthcare in the past, we've done things at our convenience. So if the patient fit into that, that was great. If not, they were going to sort of do it at our convenience no matter what, because that was the way things worked. And so we've sort of been re-examining our mission and vision and values recently, and distilled it down into 4 things, really. Keep me safe, love me, make it easy, and own it. And I think this sort of strategy that I'm going to talk about here in a minute fits into that, make it easy, and owning it as well. So if we make a mistake, we'll try to make it right. But mostly making it easy. And John addressed that sort of confusion patients have today about their bills, that they don't think it's easy. They don't understand the differences between what the EOB says and what the bill might say, or the different terminology that might be used on each of those things. So, John, let's move forward to the next item. So we, as a company, we've really been focusing on 3 things. I'm going to focus just in a couple of areas, but finding care and simplifying the access, and just having positive encounters with our patients. And the estimating of patient bills is something that I won't talk a lot about today, but something that consumers really need to understand what you end up billing them at the end of the encounter. So we really try hard to set an expectation prior to care, if it is a scheduled encounter, around, hey, this is what your insurance benefits are, this is what's going to happen, this is what we think your insurance is going to pay, and try to set an expectation. So it's not a surprise if they have one of those bills that's going to be over $1,000. A lot of people have multiple $1,000 deductibles these days, high deductible plans with an HSA, that sort of thing. So immediately their first healthcare interaction of the year is going to be fully out of pocket. Even with more generous benefit design, there's still deductibles that are growing higher and higher each year, and so it shouldn't be a surprise to us that many households have those first $1,000, $2,000, $3,000, $5,000 coming out of their pocket before the insurance company even begins to pay any of their claims. And so the next item, we're really just trying to make that experience easier. So one of the things that we're focusing on is a single enterprise-wide bill. So how do we get all of our physician bills and hospital bills onto the same framework, and to do that digitally as well? So many people pay their cable bills online, and they pay their car payments online, and maybe even their mortgage payments online, although maybe that's less common. Lots of bills get paid online, and so it's our aspiration to create this digital experience that is a single enterprise-wide bill. And then we talk a little bit about mobile pre-service payments. That's a vision of ours that is not a capability today, but is something I feel strongly is the direction we need to move, and we'll talk about that later in the presentation. And then some mobile self-scheduling and just self-scheduling from the web perspective as well is something that we're really striving to do because the patient really demands it. If you can book your salon appointment and your open table appointment for a restaurant online or on your phone, I feel you ought to be able to do the same thing for many of our diagnostic tests that are delivered in a hospital or doctor's office setting. So that's really the paradigm through which we're viewing it. And I won't talk a lot about that today because we're going to focus on the single enterprise-wide bill, but that's sort of our philosophy there. So John, roll forward here. Just to set the framework for where we're coming from is a pretty ugly experience that was black and white only on a paper statement and a pretty simple website that is not all that attractive for someone to use. It does have, an ability to pay, but I used to say this was sort of our faith-based payment center because you had to trust that the amount that we were displaying was correct. It had no ability to provide any level of summary detail on the charges, payments, and adjustments. It just gave them an amount. And if they trusted that amount, that was great. If they didn't, and they really wanted to see what their insurance had paid or what their benefits had been, what adjustments had been made, they really couldn't see that. So we roll forward to the future here, and we've got a nice bill that has an entry point that is much more attractive with two sort of key things. We have an email call to action, which was never present before. And, this is one of the things that I'm excited about. I get marketed to all day long, as most of us do. And if I get emails in my box that some, Nordstrom is having a sale, I sometimes respond to it. So I feel the same thing applies here with our hospital bills. If there's a bill reminder that, hey, your bill's ready at the hospital, people will respond to it and won't just wait for the paper statement to get there. And these email call to actions or bill reminders are really gaining quite a bit of traction. And we'll show you a little bit about that in a minute. So that's one of the things that's just new capability that we added. And then the website is much easier to navigate and is also mobile friendly. That the previous page I showed you really wasn't mobile friendly, so it wasn't able to be utilized on a phone all that easily. I mean, you could do it, but it was very difficult. So let's show them what the additional experience looks like. John, roll forward here. The desktop payments is something that I find is still the biggest driver of our payment information right now, so 73%. But I'm really excited about this mobile number. So almost 20% of our mobile payments come through mobile. And I think that'll continue to grow and grow and grow. And that's also why we're focused on, some of those other strategies, mobile self-scheduling and that sort of thing. We get about the same amount of page views from tablets and mobile and desktop as we get payment confirmations, but there's still an awful lot of tablets that come through with payments. And so almost 30% of the payment activity is from either a tablet or a mobile phone, which, I think that's pretty exciting. And, again, I think it will grow to higher and higher. I think that maybe a year and a half ago, I read a stat that said the mobile usage in terms of like page views and stuff like that surpassed desktops, sometime in the past 2 years. And so in the world, people use mobile phone on the web more than they do their tablets, more than they do their desktops. So we already know that's a trend that's holding up in other places. It's just a matter of getting the payment stuff to occur on those mobile devices. So John, let's look at the next one here. So this is what we really are excited about, is that interactive statement detail. So this is where we never had an ability to show people what the service was for, because that's the number one question. You bill someone 30 days later, 45 days later, after the claim has gone through to their insurance company. The insurance company has waited a few weeks and then remitted payment. They don't remember what it was for. And they may be gone to providers for several different things. What was this for again? This gives them a sense of, okay, this is what it was for. Here are the things that you were provided. And, oh, by the way, here's your insurance payments and adjustments and your portion that you owe. so we've gotten a lot of good feedback. This is the other thing. We never really had any mechanism to get feedback in our prior portal. I wouldn't have known if people were unhappy with it in any real hardwired way. But I will tell you that there were several people that were so antagonized by our old website that they would literally write our CEO's emails and say, my 6-year-old could have programmed a better website than this. This is terrible. They were so offended by the experience that they sent us an email. It's pretty bad. You have to be pretty upset to be actively dissatisfied. There's lots of websites I use to pay doctor's bills that I'm like, well, this is not the best, but I can make it happen. And I'm not going to take the time to go complain about it and actively, send somebody an email. But, we must have had a pretty bad experience for people to do that, because we did have a number of markets get emails like that. So we really don't get that anymore, and actually get positive feedback quite more often than not. And we'll show you a little bit more of that here in the future. The other thing I'll call your attention to is that it lays down the different bills in that unified experience side by side. So if there's multiple encounters, they can see those separately if they'd like, and the dates of service. Again, that's one of the major questions that people ask is what is that? What is that for? What date of service was this? And so this helps them keep that straight. It helps clarify what facility it was at as well. The other thing that is nice is you can put it on a payment plan here. And so one of the things you can see probably relatively small on the screen is that there's two bills for this guarantor are on a payment plan already, and they can edit their payment plan to maybe slow it down or speed it up if they maybe want to liquidate it faster. And so that's one of the biggest things that's been an uptake for us is payment plans that the patient can control. We never had the ability to do a payment plan that a patient could control. It was always you had to call us and go through at our convenience, get somebody on the phone and set up the payment plan. So we had an ability to do a payment plan. We just, didn't make it all that easy for them. And in that context, the credit card payments are scheduled, and I, as a provider, really don't have to do anything. There's none of this like making photocopies of credit card numbers and keeping them in a locked drawer or anything like that. That really probably wouldn't meet PCI compliance anyway, but there's probably people that do that in the industry. Doesn't require any of that stuff. This is totally PCI compliant, where we have a scheduled payment plan that's coming off their credit card every 30 days. And I quite like this model because people have to really actively try to get off the payment model in order to default on it or not live up to their promise. They can of course edit it here, but we really don't have very many people that default. I think last time I looked, our default rate is like less than 3% of people that begin a payment arrangement that do not finish it or liquidate their account. So very good success there with people creating a payment plan. And again, hearkening back to the original stat we showed you, people don't have $1,000 saved up. So if they've got $1,400 worth of charges, which this person does, we're going to have to give them a few months to pay that off. We're going to have to give them a year potentially. And, I think I've resigned myself. Would I like to have it paid in full? Sure. I think I've resigned myself to, I'd rather get the $1,200 or $1,400 over 12 months rather than not get it at all. Because if we don't allow people some flexibility, we just lose them altogether. They're demoralized and they just don't pay. They just let it go to collections. And so I think, this is sort of having the better part of valor and allowing people to make these arrangements on their terms. So let's move to the next slide, John. This is sort of unpacking a little bit more the payment plan functionality. So I've touched on that in the last few minutes, and so I won't go too deep into that, but people really appreciate that. We get a lot of feedback that they really like this self-controlled payment arrangement, so a self-service payment arrangement. People are responding really well to that. Who knew that PayPal would be so popular? A lot of people must use PayPal, and so we've gotten a lot of good feedback on that being an option. We of course offer the ACH payments, credit card payments, and PayPal. And so those have been that additional channel. I don't know that I could quantify that what it's been worth exactly, but we get enough feedback and comments, a handful a month that it must be helpful. So that's the other thing I'd call out, is that some of these newer payment channels are things that the marketplace is looking to adopt. So let's move forward one, John. This was something that our own internal people came up with. So they liked acronyms in their training documentation, and so they created this here for this application, and they were really happy on the provider side of the table with the solution. And so they get to interact with it when patients call in, and they can do staff assisted payment arrangements. And so they interact with it in that way. And then also one-time payments, they utilize the system to do that as well. And they can also refer to the bill that the patient has. So one of the other capabilities is they can sort of view what the patient's got in their hand. As far as the paper statement goes, that was not always a capability of all of our customer service centers. They often, didn't have the context for what exactly the patient was looking at when they were doing their customer service talk off with the patient to help them understand what it was that they owed. So let's move forward again. This is one of our larger sort of beta clients. So I think this facility went second, and they had a huge growth. This is our largest region in Orlando market, and so we had a legacy solution that had some of these capabilities. So they did have payment portal capabilities. It was not as attractive as the solution we have now. It wasn't as easy to navigate. It also had payment arrangement capabilities, but despite that, we've seen a huge uptick in the growth of the payments. I think attribute that mostly to just the ease of use and to the email call to action. So I think that helps quite a bit. We did not have that. That's one of the differences in the story prior to this implementation, is there was really no email component to remind people. So nice growth in that particular market. Let's go forward again. There's some other things here. So this is the whole company. So like I said, we have a number of assets in Florida, and then Texas, Chicago, Kansas City, other places in the Southeast. This number was even lower back in October, so this is steadily rising. 23% of the payments are self-service now, which I like, because I don't have to put in the effort of receiving a phone call and having them do something over the phone with one of my customer service reps that is really something that they could do themselves. I can dedicate those resources to other accounts that might be a problem, or reducing my hold times in those call centers. And so we're pretty excited about having 23% self-service payments, and a pretty significant decrease in early out. The early out staff are probably not happy about this, so our partners are not excited about this particularly, because we're getting people set up on payment arrangements, and we keep those in-house and don't necessarily send them out to a third party to help us work in an early out situation. So we have seen a pretty significant decrease in that, but it's just much more economical for us as a provider to do so. And if folks will input their credit card, like I said, there's not a very high default rate on people that begin a payment arrangement. So we feel pretty secure that those things can be kept in-house effectively. So let's move forward, John. So again, the self-service growth, over time has grown quite a lot. And like I said, we had other self-service tools in the past, but really not as user-friendly and consumer-friendly as these. These, again, the theme is that they can pace their payments out at what they can afford. And again, would I love to have everything be payment in full? Sure, I would. But the reality is that we're also trying to get those payments to be made up front at the time of service, and we must not be doing that effectively in some cases. And therefore, by the point we get to this stage in the set collection cycle, I'll tolerate a payment arrangement. And when we do sort of have fairly generous terms on payment arrangements, because we're not for profit and religious based, so we definitely try to work with people and let them pace these out as they need to, and again, just making it easy and making it mobile friendly. So they they consistently have been giving us that feedback on the self-service solution. Let's move forward here. So the big thing for me too is also kind of a patient satisfaction quadrant to this solution. So it is about financial. We've had a lot of financial benefits, but I really want to make sure that the patient satisfaction is something that they're happy with us, and they're going to be much more likely to come back, and also to help us with encouraging their friends and neighbors to come back. And billing is a component of that. I do think that people end up talking to their friends and neighbors about negative billing experiences. I don't know that they actively talk about positive ones to friends and neighbors. I'd like to think so, but I definitely want to make sure that the revenue cycle is not the cause for someone to be so upset that they would not use our services again. And so here's just another illustration of some of the work that we're doing to gather that feedback and to provide some surveys to the patients, so we know that we're doing the best we can. And again, I don't think I've touched on this up to this point, so shame on me, but people can opt into a paperless process, and so they can not receive their paper statement in the future and just receive the email reminders. And so for the section of patients that we have that are interested in going green, that's been one of the satisfiers, is being able to just simply get the bills via email and not have to receive those paper statements. I like that as a provider. I have less expense and that sort of thing. And I'd really like to see that adopted much more broadly in the future. But I just, there's so much of paper statements still going on in the industry, not just in healthcare, but others, that I think it'll be a little while before we get extremely high adoption there. But any little bit counts. And so that is something that we're working on and trying to address and react to the patient's preferences about how they want to be contacted and how they want to receive their bills. And again, the theme is they appreciate the consolidation of the billing, where they can have multiple encounters and multiple providers, multiple AR systems even. So physician bills are next to their hospital bills to the degree that they're, part of the same organization. And again, that we think is a pretty unique experience, because not everyone is able to do that. They sometimes have a physician AR portal and a hospital AR portal. So we're really excited about that. Let's roll forward here, John. So one of the things that we use to measure some of these satisfaction surveys is the Net Promoter Score. And so you can see that there's a number of organizations that have high Net Promoter Scores. And this just means, Net Promoter Score is something that illustrates the loyalty of your consumers. So people that promote you, or just sort of are neutral on about you as an organization, or people that are active detractors. And I think I illustrated before, kind of people that, with our billing experience, we had sort of actively antagonized, and so they were in the detractor case, I'm sure. But you can see here that when you look at the Net Promoter Scores that we're getting and compare them to some other organizations outside of healthcare and also to the healthcare average, we're pretty high. Now, this is just the sort of bill pay component of a Net Promoter Score, so it's not the entire process, but we're pretty proud of this number of respondents that sort of value these services highly. Let's go to the next one, John. So this is where I was going to talk a little bit about, and I referred to it earlier, sort of what's next in this journey of self-service and personalization. So one of the things we're working on in the next phase was simply as a partner is, go ahead and go to the next one, John, is this strategy of predicting the appropriate payment plan for people. So we talked about, or I talked about, lots of people are taking us up on offers to self-direct their payment plans. And that's great. And I really like that. But I have said a couple times, I'd prefer to get payment in full also. And so it is delaying in some ways the amount of time that it is we get paid. But I think generally we've already said $1,000 out of pockets are tough for any household to handle, and that's going to be a common theme. And so we often have bills that are higher than $2,500 even as well. So like the portfolio that I look at within our organization that has some of the lowest collectability is that range in the orange, $2,500 to $5,000. It just, it really doesn't get collected all that successfully. We have much better collection rates between 0 and 2,500. So that's one of the reasons why we wanted to set up this prediction algorithm to help us understand what to present to the patient in that email call to action. So roll forward, John, so we can show them what that looks like. So what we're using is just data about their past medical bills, their demographics, kind of where they live, and their insurance, and as well as the balance, because again, the balance has a lot to do with the prediction about whether they're going to pay that payment or not. If someone has just a small $50 bill, they're probably going to pay it despite some of the other factors that may be, holding them back otherwise. But if those bills are much, much higher, there's likely going to be a little bit lower propensity. So we're using again, sort of past historical data. We've built up quite a bit of data about people's payment behaviors and patterns. And we're sort of using an algorithm, and then sort of the end result is the patient's capacity to pay their healthcare bill. So, and this is a personalized look at it. So it's this particular bill that we're talking about, not a sort of in general or a score, like a credit score that follows them everywhere. This is specific to this bill that they've got today. So again, that's where the balance comes in. Let's go to the next one. So here's what the call to action really looks like. So in the past, it might have just said, hey, go ahead and pay the entire balance. In the future, it's going to say, hey, here's two options. Gives them sort of an A or B pathway. You can pay $100 a month or $50 a month, and they can sort of see how that hits them and figure out, okay, yeah, maybe the $100 for me, I can pay that off in 6 months. That sounds more to my liking. Or, they're going to go down the pathway B and take a year to pay it off. So this is where it's predicting a little bit more what the payment should be and sort of fitting them with a payment arrangement. And that's where some of the folks that have a real high likelihood of paying, we're not even offering them a payment plan. The first offer is pretty much pay it in full. And of course, if they go further into the website, they can set up a payment arrangement. We're not prohibiting that in this case, but that's sort of the first offer or the first negotiation point that we start with is, here's what we've got, here's what we'd like you to do. And again, that's personalized, based on that algorithm and that past history and that data. So that's something that we're really excited about. That's kicking off this quarter. So let's move forward. The next thing that we're working on is something I'm really excited about, and it's just around a vision to get our check-in process to be much, much less aggravating. And this is another area where we probably actively antagonize people. We say, here, fill out a clipboard or put your name on a clipboard, or, here's a couple sheets of paper, or give us all this information. And in all likelihood, they've been to our system before or one of our owned assets before, and we ought to really know a bunch of this information about them. We shouldn't have to start from scratch. So that's one of those paradigms that as a company we're trying to also address, is that know me. We sort of act in healthcare like this is the first time that we've seen this patient in their life, and in fact that's rarely the case. And we have a lot of the demographic information in many cases. That that's not always the case, but it's often the case. And we also sort of liken this to the healthcare industry, and my goal is to get to sort of a boarding pass like experience. I'm not saying the airline industry has all the customer service kinks worked out as an industry, but at least boarding the plane is much less difficult than it was years ago. I can do it with my phone, and I can just go straight to the gate, and there's no issues there. And we also sort of recognize that smartphones are really the way that things are going. And like I was talking about earlier, smartphone usage is largely penetrated in the U.S. particularly, and the majority of the web traffic is really from the mobile phones, no longer desktop PCs. So just in 8 years, it's gone from 20% to 80%. So let's look at what this might look like. So again, I talked about clipboards and paperwork. Got a lot of manual forms in the current process. There's staff that's sitting you down in the booth like an FBI agent and giving you an interview, asking you all these questions that, again, likely we should have some baseline information in our systems. There's really, not much of a financial call to action in the current process as much as that, I wish that weren't the case. And then there's a lot of waiting. So people sitting in waiting rooms, either filling out paperwork or just, kind of waiting for a registrar to become available so that they can check in. So it's not working, it's broken. Let's go to the next slide here. So what we're looking at is doing, some early dipping of our toe into the water on streamlining this verification. So can we, just get them to confirm, yeah, I was just here 6 months ago and I really haven't changed where I live and my insurance hasn't changed. I still work at the same place, and we can just move on. The other item is just giving them that potential estimated amount that they owe and allowing them to pay that ahead of time or set up that payment arrangement ahead of time. So there's no reason why we can't, know that they're coming in for a minor surgery, getting their tonsils out, let's say, and that they're going to owe a little bit of money there, and start the payment arrangement right then, and do that kind of financial stuff ahead of time. Nobody really wants to be thinking about the financial aspects the day they're having a minor surgery, and so we can really take that off their mind and address that several days beforehand by a call to action that sort of engages them and ask them to pay or engage in the payment much sooner. And again, just the check-in process. So that's sort of our third phase, is streamlining that check-in process. All right, let's look at the next piece. Oh, I guess that's it. So again, that check-in, I think when we get to it, the ideal state is we've gathered all the demographics, the insurance is right, and they've signed their consent form, and that's really all that they need to do. I know that there's certain government payers that require additional things, and we'll get that tackled as well. But I really think the goal really should be, how can I get enough demographic information to get the insurance claim paid if that's the payer in this case, and then move on. And so really our target is to get that consent form and those couple of aspects tied down so that we can send that patient directly to the clinical area, and they can just have that clinical encounter. They don't have to have all this administration happening in the registration area. So with that, I think do we turn it over to questions here?
Yes, thank you so much, Tim and John. We will now begin today's question and answer session. So folks in our audience, please submit any questions you have by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We'll try to get through as many questions as we have time for today. And it looks like we've already had a ton of great questions come in from the audience. And the first question has to do with the example of the electronic statement that was shown earlier in the presentation. And the question is, I noticed the electronic statement says you will not need a username or password. How do you ensure security and compliance with this option?
Yeah, sure. So we're essentially using two-factor authentication. So it's using an access code that they have on their paper statement. And so today that's something that they either have or know, and then they can enter the the site. It does not require a login though, so it's not like a password that they have to remember, but they have to have that access code, which is a one-time code. It's the same code for their lifetime. There are other ways to enter the portal. So we are working on integration with our sort of custom mobile app that's called Hello Well. And in that case, you can self-attest that you are who you are, and it goes through, I think, one of the credit bureau's processes where it asks you those sorts of questions like, in 1986, did you own a Chevy Celebrity, and did you ever live on any of these streets? And it gives you several streets. So there is an attempt to validate the person is who they say they are. But that's actually not inside of this Simply solution. That's just on our actual our portal that also houses the clinical information.
Great, thank you so much for clarifying that for our audience. Another audience member wants to know, do you use an early out agency, or do you handle your collections internally during the Simply phase or statement process?
Yeah, we do have early out agencies, but how we do it is that the statements go out and they look the same throughout the entire cycle. So even during the early out period, we're using the same look and feel of the statement. That wasn't always the case, and it always bothered me that there was sort of this abrupt shift in the statements between what the early out vendors were sending and what the facility was sending. And I care very deeply about what the statements look like and what they say, and I really want to control that. That's part of our brand, I feel, and part of the key communication with our patient. And so we are controlling that, all of the statements through that entire flow, but we do use early out coming in about that third and fourth statement period if they're not already on a payment arrangement.
Great, that is helpful to understand. Thanks, Tim. So the next question is, what are some of the challenges driving the not-so-tech-savvy patient to digital systems?
What are some of the challenges? I don't know. I think even the non-tech savvy can effectively utilize this solution. I know our partner Simply spends a lot of time on usability testing and sort of design around making it easy and not confusing the patient as best we can. I can tell you, my parents are in their 70s. They use online bill pay for almost everything. So I know that people often say, oh, what about Medicare population? The Medicare population, I know they use mobile phones quite a lot, and I don't think that an online bill pay site is sort of too much or beyond their capabilities. But sure, there's always challenges with the adoption of technology. I think we can just focus on making the website look and feel as best we can. There's not much else we can do as a healthcare provider other than just do the best we can.
Yeah, I think that is a great point. Thanks, Tim. So another audience member says that he's talking about how there is kind of a joke in the industry where most patients don't even know what they owe until the bill goes to collection. So when do your patients know what they owe?
Well, I hope when that first statement or email call to action happens. I think at least this week in the news, the Anthem CEO said the billing process is broken, and that's what he said. He said most people don't pay the bill until the first till the first collection agency statement comes. But I don't think I'm quite that cynical. And that's really not our experience. We're getting a lot of payments and adoption prior to collection agency, even prior to early out. So again, we talked about the 26% decrease in early out. It moves around each month, but it's definitely reducing the amount we're sending to our early out partners as well as bad debt partners. So I really do think that patients get it. If we can give them a decent enough summary, and I think that's been one of the keys, is giving them sort of revenue code level detail on the charges and then summaries of payments and adjustments, I think they'll get it and they'll pay it.
Absolutely. Thanks for sharing your point of view on that question. The next question is, how are you verifying how much the patient will potentially owe you prior to or at the point of service?
Yeah, sure. We're using a commercially available, estimator tool, so that there's a few of them on the market. We've just recently switched from one solution to the other, but we're using one of those sorts of tools where it has basically our contracts in it. It's using the eligibility information that the patient, has from their payer, the 270, 271 transaction, and then, some historical information about the service for which they are scheduled. And so it is taking that estimate and putting it back in our system, and then we have kind of an estimated amount due that we'll be serving up as the call to action to pay ahead of time through that mobile solution. So that's not GA yet. It's something that we're working on, but that's how I envision it working, is that estimate is automated because we've got an order and an appointment tied to an eligibility that's tied to, a historical sense of what those total charges are. And then that gets us to our estimated amount that we can, move over, and a couple of days ahead of that arrival date of the patient, we can use that to email them and do that call to action on the amount due. My CFOs always ask me, like, when are we going to stand behind our estimates and not, bill the patient if we undershoot the estimate, or, certainly we'll always give them money back if we're overestimating it. But, we're not guaranteeing our estimates right now. We have disclaimers on them and such, but I'm ready to do that in the next 2 years, as long as I can get that estimator to be very reliable, and I can quantify that dollar amount that we might lose if we guarantee those estimates. I think I'm fairly close to begin thinking about that. So I do think that's another patient satisfier, where we'll say, look, if you pay this amount in full or via payment arrangement over the next 2 or 3 months, we won't even bother you about this bill, even if we're wrong about the estimate. Even if we're under with our estimate, we'll still just we'll forgive the difference. I think that will be a nice satisfier for the patient. So we're looking at those sorts of things.
Great. I think that's helpful for our audience to understand as well. So the next question has to do with the software mentioned during the presentation. Have you built the software in-house, or are you using a vendor? Excuse me.
No. This is a vendor simply.
So let me ask you a follow-up to that. Another audience member said, why simply? Were there competitors that you had to choose from?
Sure. Yeah. No, there definitely are competitors. There's a few folks in this space. I think what we chose simply for was some of these sorts of things. Their demonstrated ability to drive that Net Promoter Score, and to sort of keep it simple for the patient, as well as provide that guest experience and low barriers of entry to the website. It was certainly all vendors claim they can drive adoption, but we felt the best about Simply's ability to really truly move the needle on the adoption from where we were.
Great. Thank you for sharing that, Tim. Another audience member wants to know more about the patient payment plans, and they said, are there guidelines for patient payment plans to avoid a lengthy collection period? For example, not allowing a patient to pay $20 a month on a $10,000 balance.
Sure. Yeah, we do. We have outer limits, both on the number of months and the dollar amount. So I think today it's something like $50, and we don't go longer than 24 months. I mean, there's other mechanisms to go longer. Of course, there's loan programs and other things like that we offer, but they're not that common. But I think we're I think we're able to fit people into those guidelines, most of the time.
Great. Thank you for that informative response. So how do you handle those accounts of people who receive urgent services but may be unemployed or without insurance?
I think we probably handle them like most people. We do what we can, and again, here we as a not-for-profit faith-based organization, we can also take a look at charity for them if they meet the income requirements. We also, discount the bill under the 501R regulations, and so we try to make it somewhat more affordable than the full charge amount. But then, absent charity or any other payment source, what's going to have to be worked on is either a payment plan or some sort of loan program.
Absolutely. Thanks, Tim. So the next question is, once a payment is received from the patient, how do you guys then allocate those payments effectively across Adventist?
Yeah, I'm not sure I follow this question. I think what they're referring to is how do you keep it straight when you're paying multiple facilities where those facilities might have multiple bank accounts, maybe? So the credit card transactions have to settle into different bank accounts. The patient really has a single facility. They pay each individual facility's bill individually, and so it's separate transactions. And so if you look at the credit card statement, it would be separate transactions, and so that's how it keeps it straight. It's a separate credit card transaction that settles to a different bank account if it's facility A versus facility B. There is, I think, a future development that will be solving that sort of gives you the multiple facility single click shopping cart experience, but we do not have that today. But I do think it'll be probably solved by the end of the year, something like that.
Great. Well, that is actually all the time that we have left for today. So I want to thank Tim and Simply for the excellent presentation and to our audience for participating today. Please enjoy the rest of your day, and we look forward to having you join us for future webinars.